Okay, everyone, welcome to our Healthy Back Workshop with Dr. Chad Cohle.
Hey guys, all right, thank you, Maggie, appreciate it. Everybody here, thanks for coming this morning, and everybody online now and that's going to watch it later. So my name is Dr. Chad. I am a chiropractor, and my practice is all the way over on the East Shore. So I did make the harrowing journey over to the West Shore today. My primary focus here today is going to be back pain. I work with a lot of people that are active. I'm also in a gym. My office is in a gym, so I work with people just like all of you guys, and it's something that I really enjoy. So today I thought, given that most people are working from home and are not at their preferred desk setup, working at the kitchen counter or on their sofa, or whatever it might be, we see back pain a lot now because of that. And certainly now that you're going from sitting at the kitchen counter and then running into the gym, whenever you get a chance, there's always a chance for more back pain. So I want to talk about a couple ways where you can prevent that, some things you can work on at home that don't require any equipment. And then we'll also talk about one of the most common things I hear is, oh, my core is just weak and that's why my back hurts. And there's some truth to that, but we're going to talk about where you really need to start instead of just going and doing a couple hundred sit-ups every day. That's not going to get you anywhere. So we'll talk about how we want to approach that. So we'll talk about how we're going to approach the whole core concept and how we want to really focus on strengthening the core first. As we go, if anybody here has questions, or anybody on the internet there, if you guys have questions, you can, I think there's a chat, you can put them in there. I'll give my contact information too. And so if at any point after this, you want to shoot me an email, ask me some questions, we'll talk about that later. Please feel free to reach out. So the first thing that we were just speaking about earlier, whenever somebody's talking about pain with me, it's very easy to figure out where the pain is. That's not my job. You guys know where the pain is. You can pinpoint it. You can say it hurts here or it hurts in the back. My job is to figure out where's the problem. So we know where the pain is, but where's the problem? And with back pain, one of the most common things people come in with is they say, I haven't stretched enough, or my posture isn't very good. And while those things may be true, they're usually not the biggest issue. So the biggest issue I see with back pain is not a tight low back. It's not hamstrings that are really tight. It's not necessarily a weak core. It's actually that your rib cage is out of position. And so rib cage controls pretty much everything. So we're going to talk about ways where you can reposition your rib cage. We'll talk about breathing. And then I'll show you some exercises as we get into it as to how to utilize that idea of the rib cage. And you can take this and use this for shoulders. You can use it for elbows. You can use it for hips. The rib cage is in the center of the body. If that's out of position, everything else now starts to shift and change off of that. So our first exercise, or our first concept, is going to be laying down on your back. So let me see if I can tilt this. Okay. Okay. So the first concept here is, most times when people lay on their back, can you see this arch underneath my back here? Pretty commonly, we'll see some degree of this, whether it's a big arch or if it's just a little bit. But a lot of times, you'll get an arch in the low back, and then the rib cage here, if you look straight down, you'll see that the ribs have kind of flared open. So what that represents is, when you're standing or when you're sitting, you're often in this position. I'm going to exaggerate, but we're often arched and flared. So when we get on the ground, the first thing I have people do is arch really heavy and then close that arch down. This is the position I would want you to hold. So what we're doing in this position is we're pulling the rib cage here down, and the low back flattens, and these hips actually rotate forward. So just by doing this, you should feel a really good core engagement. So here your abs should already be squeezing pretty good. That's the first step. So first we need to get into a better position. From there, then we have to learn to breathe in this position. So you'll start here, we'll close that down, and then you need to learn to belly breathe from this position. So that's the second common thing I see, is that people breathe from chest and shoulders. Take breaths like this. And what does that do? It ends up flaring that rib cage more. So we've always learned, when we need to learn a new skill, we start on the back, on the ground, something like that. It's the easiest. If I'm going to teach somebody something new, I'm going to start them on their back on the table, because that way you don't have to worry about gravity, you don't have to worry about balance, you can just focus on that one exercise. So in this case, we have really 2 exercises in that one position where you essentially aren't moving at all except for your rib cage. First step, pull that rib cage down, lock that in, and then work on still breathing through the belly. If you can work on just those 2 things alone, that's going to help your back pain a lot. And it's going to give your core a lot better activation as you work through the day. Because eventually, I can take this up now. Eventually, that positioning from the side, if normally we're trying to sit up right here, this is the same position as when we were on the ground and we had that arch in the rib cage flare. So when we're sitting, after we've mastered the on the back exercise, now we want to work on pulling that rib cage down, flattening this back out a little bit when we're sitting. So this transitions really nicely into your question earlier, your comment earlier about sitting all day and feeling slouched and trying to sit up straight. So this is a case where slouching actually isn't that bad. We're really taught to sit upright. I don't know where, we all learned it in school, and whether you had parents that made sure you were doing it or not, but we're all taught to kind of sit up this way, right? Like sit up really nice and tall, shoulders back, chest high. But again, look what happens. That rib cage automatically flares. We get the low back muscles start to squeeze. So if you guys do that, like try that for me. Sit up into what you think is perfect posture. All right. And I want you to pay attention. What happens to the muscles in the low back? They squeeze, right? So relax, go back to your normal posture. Now imagine you squeeze your fists all day like this. So just squeeze them like you're getting ready to throw a couple punches at that speed bag. Okay? Now if you hold your fist like this for 8 hours, what do you think is going to happen to the muscles in the fist and in the hand? It can be really cranky, right? So why do we want to sit up like this? We're doing the same thing to the low back. So I'm not going to tell you to slouch this way, but I am going to tell you the best way to relax your back if you're sitting is work on the breathing and the position we just did on the floor. Pull that rib cage down, and then watch my length about through here. So that just comes off the chair a little bit. So for ladies, about where the bra strap would be, that's where you should, that's the last piece that should be touching the chair. Everything else should kind of be slouched a little bit forward. For guys, you can imagine where, figure that out. So if we're here, if normally we're up like this, we want to get here. So just a little bit. Now you can try this position. You can sit in that position for quite a while and feel pretty comfortable. Okay, so those are the first 2 transition points we talk about. You're lying down on your back, that one you're not going to be able to do at work. This one, everybody can do no matter where you are. So I would like to give the extreme examples of exercises. I don't want you here. I also don't want you like this. So find that middle ground. That's why I give that landmark kind of where the bra strap would be, so you can kind of lean forward at that point. In this position, we'll get the rib cage coming down a little bit. We get the hips roll forward. Now we're working on a lot of different things while we're sitting, instead of trying to fight and stand up nice or sit up nice and tall. So most people, even if you're taught to sit up straight and you've been hammering this for years and years and years, the minute you may be able to do that for 2 minutes, but the minute something else happens, whether it's with work, whether it's your kids are coming in, you start to resort back to your default anyway. So let's embrace that default and go into that position. That should help a lot of people, just that alone, with sitting at home all day. All right. Does that make sense so far? Everybody with me? Super simple. We're going to talk more about slouching now, because this is an easy way to isolate out the back and bring in the hips and the glutes, which is going to save the low back. So our next exercise is something that I like to do in the morning when I get out of bed. I'm a little stiff. This is one of my favorites to do. It's very simple. So you'll sit, feet about shoulder width apart, and all you're going to do is slouch. Now, when I say slouch, you have to fully commit to the slouching. So you're going to tuck your chin, arch all the way down, and then try to get your palms on the floor. Okay, so we're gonna hold there. Now, the difference with this exercise is you're not just lifting back up like this. What you're gonna do is you're gonna pretend like you're smashing an orange underneath the balls of your feet when you press back up. So we're gonna start, just take this down a little bit. Okay, so we're gonna start feet about shoulder width, slouch everything, get down to here. We're gonna stay, everything must stay very slouched. So even the head and the neck, you're gonna have a tendency to wanna keep your head up. You have to slouch everything. Slouch here, and then we're gonna press down through the toes and come back up while we stay slouched. So here, press down right through here, right through the ball, like where your big toe would be. You're gonna grip that into the ground and push up. And when you do that, you should actually feel, you wanna try to feel your glutes engaging to lift you back up. If you feel this in the low back, 9 times out of 10, what happened is you went here and then you either looked up or you tried to flatten your back and you lift it up like this. And that goes back to rib cage coming out and us using those low back muscles way too much. So try this. You can try it throughout the day as well, but that's a really easy way to stretch and also to take some pressure off the low back. So like when I have a patient that comes in and their low back is just on fire and they can't really do a whole lot, I'll do the lying down one and then we'll do this one. And those two things alone are great things for homework, but that will get the back to calm down pretty nicely. All right. Now, the next most common movement I see that bothers people is going from a seated position to standing. These are all the same concepts. So hopefully you'll start to see how one movement, one position, you can translate that to a lot of different things in life. So most people, when they stand up, will go this way, and then we'll kind of arch like this, right? Again, rib cage ends up popping out. We start arching the low back. So what I want you to do instead is we're going to go here. We're going to slouch again. We're going to go forward, press down through the toes, and then stand up like that. Same concept as when we're sitting. We're going to press down through the bottom, through the ball of the foot. Imagine there's an orange or a tennis ball or something down there, and you're really trying to smash that into the ground. You're going to feel that in your glutes and in your hamstrings and your calves. So again, the same concept. We'll start here. Everything has to stay slouched. Get the knees coming forward. Press down through. And then stand up. It takes everything off of the low back. Those are 3 really, really easy exercises that you can do that's going to help that back pain. Almost exclusively, the back is on fire because it's just been working too hard and you have an imbalance of musculature. So again, like I said, beat meets all my points when we spoke earlier. But a lot of times people think about chiropractic and they think that if they have back pain, we're just going to go in and adjust it and crack and pop it and that's going to be it. That's not fixing how you move. So we're not fixing how your rib cage is positioned, or we're not teaching you how to stand up, those types of things. The next thing, I just remembered this now, seeing somebody come in from their car. So another problem people have if the back is a little fired up is getting in and out of the car, right? Just that weird kind of movement. So if I'm in the driver's seat and I'm getting out, I'm going to put my left foot out. Where are we going to start? Slouch, right? So we're going to slouch. I'm going to try to get this left knee really far forward because I'm going to try to smash an orange underneath the ball of this foot. So we'll slouch, get over, push up through, and then stand. And that's how we get out of the car. You didn't slap it. Yes. But that's an easy way to try. Try it with some people around first.
Yeah.
Well, especially the short legs, I get that. You'll be so close to the ground to just follow it.
Yeah. So that's another way to utilize these concepts. And I have to keep stressing that the slouching feels weird and we're so averse to it and we're not used to doing that because we've been taught for so long, never slouch and make sure you're upright. if you can do these exercises, you have to commit to that slouching. If you feel it in the back, again, like I said, it's almost always because your neck popped up or you tried to arch and straighten out a little bit. But if you stay slouched, everything will work out fine. Your hips will move you. And that's what's really supposed to happen. Make sense? So you can do those three things alone. It's going to help core. It's going to help reposition the rib cage just repeatedly. You'll start to develop stronger, what we call obliques, which are the muscles that help you twist and rotate, but they also help pull that rib cage down into a better position. Another common thing that this helps that people don't really think about is, if anybody's out there ever had pain just to the inside of the shoulder blade, this is a big movement for that. So if you got pain back here where you feel like you just want to press on it, there's a big knot back there right next to the shoulder blade, almost always because you haven't allowed that rib cage to move properly. So yeah, this is a low back workshop, but that's another way where you can start to utilize these same concepts for other aches and pains all the way up the spine. I mentioned earlier that if you can develop the rib cage movement properly, it can translate to a lot of other things. So if anybody's watching, maybe you don't have a lot of back pain, or you also have shoulder pain, this is a really common problem in shoulder pain. So if you're doing a lot of bench, or if you're doing a lot of push-ups or chest, or really anything upper body, and you start to get shoulder pain anywhere, one of the first places I'll look is that rib cage position, same thing. So if you're on a bench and you're doing bench press, whether it's dumbbell or barbell or whatever, or just a push-up in general, if you can focus on keeping that rib cage tucked down and that back a little bit flatter against the bench, you may have to go down in weight initially, but it's really going to help your shoulders. And you're going to feel it in the pecs, which is where you should, instead of feeling it in the front of the shoulder, where sometimes we get that really sharp pinching pain. So start taking some of these concepts and seeing how they can apply to a lot of other exercises that you do. Again, it's very easy to pinpoint where the pain is, but until we identify where the problem is, we're just going to miss it. And it's easy to stretch that area that hurts. It's easy to crack and pop that area that hurts. But if we don't really go and look and figure out why it's there in the first place and how to correct it, there's a chance you always have to deal with it, or it just shows up somewhere else. So those are the three big exercises I have. Anybody have any questions live first? And then I don't know if we can see questions on there. If there's a
Yeah,
chat
they
or not.
can talk.
Okay.
Or do you want, you can unmute yourself and talk if you have a question, or you should be able to chat as well. It would pop up. Did you have some core exercises you said too that you wanted to show?
Yep. So the core exercises will be really just a development off of the rib cage stuff. So our first one is, bring this down a little bit. Good. So our first exercise for the core, we've already gone over. And this is where I start everybody. If you can't pull this down, this rib cage down, hold it, keep the back flat and the neck on the floor. So it's another common thing is people will do this. That's cheating. You can't do that. You have to lay flat and you have to pull that down. So this is exercise number one. If you can't do this, then you can't do sit-ups, you can't do V-ups, you can't do anything else. You have to be able to do this first, at least in my world. We have to be able to manage this. Secondly, you have to be able to do this, hold this position, and then still breathe from the belly. You have to be able to stabilize first. Then you have to be able to breathe while you're stabilizing. Then the next exercise I'll show you is the movement part. Stabilize, breathe, move. If we don't have that pattern or that progression, then we've got to start over. So no matter how advanced you are, if you can do sit-ups, pull-ups, knees to chest, knees to elbows, that's great. But if you can't do this stuff, then you're going to run the risk of hurting yourself at some point down the road, because this is a foundation to any type of ab exercise. So that's number one. So we have stabilizing, which is getting you in the right position here. Then we have breathing. The next part of the exercise, down and breathe. Once you can do that, the next progression is holding this and then adding a bit more movement, just with the leg and back. It's the same concept. You have to be able to hold that position. In all of these exercises, I'm a huge stickler for form. If your rib cage flares or your back pops off the ground or your neck comes up, that's the end of the rep. And I'm a big fan of doing what we call isometrics, which means holding those exercises instead of doing reps. So in the very beginning process of rebuilding some core, I always like to do the holds. As we get more advanced, then we can start doing reps. But first, you have to be able to stabilize that and breathe and do the movement. Then we can start adding more movement as we go. But those two things, that's where I would start with everybody. So if you have back pain, even if you're just looking for new ab exercises, these are where you need to start. Well, our benchmarks for the first one, where you're not doing any movement, you're just pulling the rib cage down, holding and breathing. We need 3 sets of 30 seconds of perfect reps. Once you can do that, then we can lift the legs up. Then that next benchmark is 3 sets of 60 seconds. Same thing, you have to be able to hold that position perfectly. You take a minute or two break in between, but if you lose it or you cheat or something pops off the ground, that's the end of the rep. And I do want to stress, some of these are going to be challenging for some people out there, and for you guys, they may be difficult, and that's the idea. I don't give people exercises that are super easy to do, otherwise it's a waste of your time. So when I give these to patients, my expectation is that you're not going to be able to nail it right away. You're going to have to work at it. And that's the whole idea, is to challenge you and to pick the movements that you can't do really well yet and help you with them and get you better at it. If anybody watching, or if any of you guys can do these two things, send me an email and I will show you the next progressions. It involves a little bit of band work, and they're definitely a lot more challenging, but start with this first. This will do. Even if you can do this easy, but you have some back pain or hip pain or even shoulder pain, start with this stuff first. Don't worry about the crunches. Don't worry about the sit-ups. Master this first, then you can move on to all of that other stuff. Okay. Sense? Cool. Okay. Anybody else? Any other questions? Anything else? Did I miss anything?
If you guys have specific back pain, that's anything different than what you talked
The lower and the shoulder blades, like you said, is exactly where,
Pretty common.
about?
Yeah.
and sometimes it does feel like my ribs are like out of whack, like right in here.
Yeah. You
Especially
get a
on
little
this side,
rotated.
so
Mhm.
I'm
Yep.
not sure I read something about like, is there a floating rib or something like that?
So yeah, you have a couple floating ribs. They just mean they don't attach to the bone. They kind of just hang there, and they'll move a lot as you breathe. But it's hard to see. I mean, you guys can see it here in person, and on Zoom, it's a little bit more difficult to see the breathing mechanics. But like I said in the very beginning, we work on that all the time with patients, because if you can't breathe, then anything you do in the gym, it's a toss-up. I don't know if you're gonna be able to do it right or not. I don't know if you're gonna get hurt or not. So we always work on breathing, and that's gonna help those ribs expand the way that they're supposed to.
I have asthma, so I'm always, that's another one of my issues when I'm here working out.
Yep.
But after listening to you, maybe is it really all my asthma, or is it that I'm not breathing
Yeah.
right and everything's out of whack and it's causing me to have more issues?
I would guess it's both. I mean, I've had a lot of patients that have asthma or exercise-induced asthma, those types of things, and a lot of times, I'll never say we fix asthma, but when we retrain them on how to breathe, now they're getting a lot more out of their lungs. Their lungs are able to expand a lot better, which means we're able to get more oxygen in, and we're able to get in a better position for more efficient movement. So yeah, I've seen a lot of change in that just by working on the breathing alone. Yeah, good question. Anything else? So the last thing, and I did this last time too, but we always have what's called a discovery visit for our office, and it's free. It's 20 minutes. You can come in, you and I, we can sit and talk in my office. I can move you around. We can test out some of these different things. And at the end, at least I will tell you, one, if it's something I can help with, and if it's not, I'll tell you. But I can also give you an idea really of what's going on, because that's one of the toughest things I think now is we have access to so much information on Dr. Google and YouTube and all this stuff, is that you can Google your symptoms, but you don't know if that's really what's going on with you. And so at the very least, I will tell you, this is what's happening with you. A lot of people come in and think it's sciatica or it's a pinched nerve or a disc or something, and often it's not. And so sometimes just knowing that is a bit more, is a bit of relief for patients. And sometimes we go through the treatment, and other times we say, great, I just wanted to know what the heck was going on. And they have a bit more peace of mind, and then they can go forward from there. But I always like to offer that to patients or to people that are interested. If you have anything going on, you can get to know me a little bit better, my type of treatments, because we don't just do the cracking and popping. Some patients, we don't do that at all. It depends on what everybody needs. And so you get to see a different side of chiropractic, I think.
Where are you storing?
So we are, do you know where Dick's Sporting Goods is out there? There's Dick's, Cole's, Jonestown Road.
Oh, yeah.
Yeah, out that way. Yeah. So from here, it's 20, maybe 25 minutes, depending on traffic. Yes. Yeah, Cohle Park area. Yeah. So if anybody out there, if you're interested, either shoot Maggie a message, or you can go to our website and just request a discovery visit. Just mention that you watched the workshop today, just so I know, kind of what you're dealing with, and we can go from there, and I'll reach out and we'll get that set up. And it doesn't have to be back pain if you have something else going on, but I do want to offer that to people. If you're curious about what we do, or you just want to get a better idea of what's going on with yourself, then by all means, please reach out. Cool. Okay, guys. All right. See you. If anybody has any questions, let me know. Shoot me a message. If any of these exercises were difficult to see from the position we had it, just get in touch with me, and I'll send you a video of my own that will be a little bit more easier to see. All right. Have a great Saturday, everybody. See ya.